Welcome to Module 6, HIV AIDS. The instructor for this module is Dr. Aditya Dipti, Assistant Professor, Department of Chemistry, St. Joseph's College for Women Autonomous, Visakhapatnam. The contents of this module are immunity, CD4 cells, CD8 cells, retrovirus, replication in human body, investigations available, prevention of AIDS, drugs available, examples with the structures of protease inhibitors, indivanir, otherwise known as crixivan, and nelfinavir, otherwise known as Vyrecept. The outcomes of this module are: by the end of this module 6 on HIV/AIDS, students will be able to realize the causes and effects for HIV, identify the most suitable confirmatory test ELISA, and sketch the structures of nelfinavir and indivanir, and distinguish between HIV and AIDS, and summarize the causes and control measures of HIV/AIDS. Module 6 contains of 4 chapters. Chapter 6.1 deals with the introduction to HIV/AIDS and its epidemiology. The contents of 6.1 are: 6.1.1 deals with the overview of HIV/AIDS, including its origin. 6.1.2 deals with the difference between HIV and AIDS, and 6.1.3 deals with the causes for HIV/AIDS. The outcomes of this chapter are: to understand HIV and AIDS, to learn about the origin of AIDS and its epidemiology, learn the difference between HIV and AIDS. Overview of this chapter: HIV/AIDS. What is AIDS? AIDS stands for Acquired Immunodeficiency Syndrome. Acquired: the disease is not hereditary but develops after the birth from contact with the disease-causing agent. Immunodeficiency means disease is characterized by weakening of immune system, and syndrome means a group of symptoms that collectively indicate or characterize a disease. Acquired Immunodeficiency Syndrome (AIDS). It is a retroviral disease caused by the human immunodeficiency virus. AIDS was first reported in 1981 in homosexual men. The disease is characterized by immune suppression, secondary neoplasm, and neurological manifestations. What do you mean by this retroviral disease? A retroviral disease or a retrovirus is a virus that uses RNA as its genomic material. That means if RNA is used as the genomic material, that type of virus is known as retrovirus. And immune suppression means suppressing the immune system. Epidemiology. Epidemiology means it is the study of the determinants, occurrence, and distribution of health and disease in a defined population. If you take a particular place, in that place how many are affected by a particular disease, that defines epidemiology. The first cases of acquired immunodeficiency syndrome were reported in United States in the spring of 1981. By 1983, the human immunodeficiency virus HIV, the virus that causes AIDS, had been isolated. Early in the US HIV/AIDS pandemic, the role of substance abuse in the spread of AIDS was clearly established. Injection drug use was identified as a direct route of HIV infection and transmission among injection drug users. The largest group of early AIDS cases comprised of gay and bisexual men. Early cases of HIV infection that was sexually transmitted often were related to the use of alcohol and other substances, and the majority of these cases occurred in urban, educated, and white monosexual men. In 1983, HIV is isolated. In 1984, serological tests developed to identify the infected persons. 1985 reported anti-HIV activity of suramin rabivirus is published. 1986 clinical trials of zidovudine show efficacy in AIDS and advanced AIDS-related complex. In 1987, zidovudine AZT licensed for clinical use in many countries. Large-scale clinical trials of zidovudine and other agents began. In 1991, didenosine is licensed for the use by US FDA in selected AIDS patients. As we already discussed, epidemiology means taking a particular area, we will be identifying how many are infected in that particular region. So, coming to the AIDS epidemiology, first case was identified in USA in 1981. 1983, HIV virus is isolated from a person, and in 1984, tests were developed to identify the infected persons. In 1985, anti-HIV activity of suramin was published. In 1986, one drug was introduced, that is nothing but zidovudine, which shows efficiency in decreasing the HIV in the body. And in 1987, this zidovudine is licensed for clinical usage. And in 1991, didenosine and another drug is also licensed for the use by US FDA in specified AIDS patients. Till now, we just know what is AIDS, what is HIV, and what is epidemiology, where like at which year this HIV is seen, and how the medicines grew up like that. But actually, where did this HIV come from? There are many myths and theories regarding this HIV. Let us now discuss the myths and theories regarding this HIV. Of many theories and myths about the origin of HIV, the most likely explanation is that HIV is introduced to humans from monkeys. Some studies say that it is identified from a subspecies of chimpanzees native to West Equatorial Africa as the original source of HIV-1, which is the virus which is responsible for the global AIDS pandemic. Some researchers believe that the virus crossed over the monkeys to humans when hunters became exposed to infected blood. Monkeys can carry a virus similar to HIV known as SIV, that is nothing but simian immunodeficiency virus, and there is a strong evidence that HIV as well as SIV are closely related. Here you can observe the picture where it is given that this SIV from monkeys, the HIV is jumped from monkeys to humans. And the virus in monkeys is known as SIV, and in human it is HIV. AIDS is caused by HIV infection and is characterized by severe reduction in CD4 plus T cells, which means an infected person develops a very weak immune system and becomes vulnerable to contracting life-threatening infections such as pneumocystis carinii pneumonia, and AIDS occur late in HIV disease. That means AIDS is caused by HIV infection. HIV is the virus and AIDS is the disease. And how it is characterized? It is characterized by the reduction of CD4 plus cells. CD4 plus T cells are responsible for the immunity in the body. So when the immunity cells go down, what happens? The virus grows faster in the body, and that causes AIDS in the human being. Tracking of this disease in the United States began early after the discovery of the pandemic, but even to date, tracking data reveal only how many individuals have AIDS, but not how many have HIV. The counted AIDS cases are like the visible part of an iceberg, while the much larger portion, HIV, is submerged out of sight. Many states are counting HIV cases now that positive results are to be gained by treating the infection in the early stages, and because counting only AIDS cases is no longer sufficient for projecting trends of the pandemic. However, because HIV infected people generally are asymptomatic for years, they might not be tested or included in the count. The Center for Disease Control estimates that between 6,50,000 and 9 lakh people in the United States currently are living with HIV. Means just now I explained you that HIV and AIDS are completely different. HIV is the virus and AIDS is the disease. That means if HIV cells are more and more, it leads to AIDS. So the counting of this disease started in USA. So at that time what happened, the HIV virus if present in the body are very difficult to identify, and till it changes to AIDS it cannot be identified, or it could not be identified in the past years. So for that reason it is like an iceberg where you can see only the ice that is floating over, and the lower one which can't be seen is nothing but the HIV, and the outermost part which you see is nothing but AIDS. That means so many cases are present having HIV, but we see only the AIDS cases. In 1996, the number of AIDS cases and deaths from AIDS began to decline in the United States for the first time since 1981. Deaths from AIDS have decreased since 1996 in all racial and ethnic groups and among both men and women. However, the most Center for Disease Control data show that decline is slowing. The decline can be attributed to advances in treating HIV with multiple medications known as combination therapy. Treatments to prevent secondary opportunistic infections and a reduction in HIV infection rate in the mid-1980s prior to the introduction of combination therapy. The latter can be attributed to improved services for people with HIV and access to health care. Till 1996, there are no medications or the combination therapies that are used to treat HIV disease. So till then, deaths regarding the AIDS cases were more and more. Coming to 1996, where the combination therapy was introduced, from there these AIDS cases were being decreased. This Center for Disease Control means it just calculates all the AIDS patients or the any of the disease in that particular area. So this Center for Disease Control estimates that between 6,50,000 and 9 lakhs people in the United States are currently living with HIV. This data is of 1997. So at 1997 data, they estimated that 6,50,000 to 9 lakh people are living with HIV. I said HIV, it is not AIDS. HIV is still largely a disease of monosexual men. Monosexual men means this homosexual men and male injection drug users. Those drugs which are used to inject. But it is spreading most rapidly among women and adolescents, particularly in African American and Hispanic communities. HIV virus that thrives in certain ecological conditions. That means it lives in particular ecological conditions. The following will lead to higher infection rates. What are those? Potent virus. That means if the virus is more and more, high viral load, high rate of unprotected sexual contact with multiple partners, and low access to health care. These are all discussed in chapter 3 and 4, that is chapter 6.3 and 6.4 in detail. So now we'll learn about the epidemiology from 1995. As already said, till 1995, there is no medications like combination therapies were used. So the cases of AIDS are more and more. But from 1995, as the combination therapy was introduced, let's now discuss about the epidemiology from 1995. With the advent of new and effective treatments, the epidemiology of HIV/AIDS is changing. The study of HIV/AIDS epidemiology helps to identify the trends of the disease. Surveillance of AIDS cases since 1996 shows substantial decline in AIDS-related deaths and increases in the number of persons living with AIDS. Although the decline is slowing, as people live longer with HIV or AIDS, the ability to use AIDS surveillance data alone to represent trends has diminished. It is difficult but important to track the distribution of prevalence and incidence of both HIV and AIDS cases to detect changes in geographic, demographic, and risk exposure trends. What is this? From 1996, as we distinguished, not we, those people distinguished HIV and AIDS. So people living with AIDS and people living with HIV were distinguished into two cases. So people living with HIV are using this combination therapy where the virus is being decreased, not completely removed, but it is being decreased and the lifespan is being getting longer. Coming to the AIDS patients even, AIDS patients, what happens, it will be more and more, HIV will be more and more. So when HIV is more and more, what happens, it leads to death. So in order to reduce those death cases in AIDS also, these combination therapies were used in order to make their lifespan longer. So from that time, the Center for Disease Control started to count both the HIV and the AIDS persons or AIDS infected persons both. And the lifespan of AIDS patients have been increased because of this combination therapy and also identification. Let's learn what is the difference between HIV and AIDS. The definition of AIDS was established before there was effective treatment of HIV. Now let us discuss what is the difference between AIDS and HIV. AIDS means acquired immunodeficiency syndrome and HIV human immunodeficiency virus. What is acquired immunodeficiency syndrome? It is acquired from some other person, not it is acquired from born stage. And HIV human immunodeficiency virus. That means virus which suppresses the immune system. And AIDS is a medical condition where the immune system is too weak to fight infections, and HIV is a virus that attacks immune system. What causes AIDS then? AIDS is caused by the infection with a virus called human immunodeficiency virus. This virus is passed from one person to another through blood transfusion, sexual contact, and infected pregnant women can pass HIV to their babies during pregnancy or delivery, as well as through breastfeeding. How the virus is passed? It is passed from one person to another through blood transfusion or sexual contact, or the pregnant woman from the pregnancy after delivery it is carried to the babies, and through breastfeeding also it is being carried to the babies. So till now what we have learnt: the epidemiology of HIV AIDS, realized the causes for the incidence of the disease, and understood the difference between HIV and AIDS. So in the next chapters we'll be learning about the structure of HIV, transmission, immunity, phases of transmission, symptoms, prevention methods, tests available, and the structures of protease inhibitors. Thank you. We'll meet in the next chapter.